Well, we did see a shift in the governor's messaging on coronavirus, saying plainly cases are increasing. And as Stevie said there, you should be wearing a face mask. But at the very same time, he's pushing back on concerns Arizona hospitals are reaching capacity. ABC 15 investigator Melissa Blasius was at the governor's news conference for us today and has the very latest on how our healthcare system is faring in all this. Melissa?
Yeah, that's right. Governor Doug Ducey saying today that moving forward, they are going to be putting extra attention on vulnerable populations, like people living in nursing homes. But he also said that there was a lot of misinformation out there about Arizona hospitals being full, and he said he wanted to correct that. Arizona hospitals clearly seeing an influx of coronavirus patients. This week, the highest numbers yet of COVID patients in the emergency room, admitted to the hospital, and in the ICU. Governor Doug Ducey responding this way.
We have the available bed capacity and surge plans are in place to continue to serve the people of Arizona. We are well prepared to manage an increase in patient volume.
The governor showing this chart, highlighting at the right the total beds available and saying hospitals can surge their capacities, adding 2,600 beds and 600 ICU beds on top of today's totals if necessary. The state health director says there are also backup plans for extra staffing.
We could recruit volunteers through our ESAR VIP resource, and then we can also request federal resources to come in and provide additional staffing if we need.
Hospital capacity became a critical issue last week as Banner Health announced that they were seeing an influx of the sickest of the sick, and their ICUs were nearing their 100% licensed capacity. The governor says state health officials are working to balance patient loads across the state, and as of yesterday, they averaged 84% full for inpatient and 78% for ICU beds across all hospitals. At the same time, Governor Ducey is not moving forward with any further reopening of the state at this point, nor any backtracking, balancing economic and health needs.
We know that it's in the community. We are not going to be able to stop the spread, and so we can't stop living as well.
And while the governor has frequently appeared at official events and in photos without a mask, he is now recommending that people wear masks if they are in places that they cannot socially distance.
I was in Walgreens picking up some things on the way home, and I've been to the grocery store. In both places, I wore a face mask, and face masks are good.
And again, hospitals are not full in Arizona as of today, although a University of Arizona professor who does a weekly report on the spread of coronavirus in Arizona says if things continue on the same trend as we've been seeing in recent weeks, we could be at that 100% licensed capacity by July. Of course, then we do have some surge capacity and some other options beyond that. I'm investigator Melissa Blasius, ABC 15, Arizona.
Of course, real-life Arizona families in the fight of their lives behind those numbers as well. We always keep that in mind. Melissa, thank you so much.